It's wonderful to be here for a variety of different reasons. I'm here with friends and colleagues who I have known over the years, who I have worked with in a variety of different capacities. And so it's just, for me, a real honor to be here and represent CARE and the work that we do. I would, and as for all of you who were here yesterday for the incredibly stimulating panel, it is wonderful to be in the presence of people who bring so much and who represent for us a real beacon in our world as we think about this whole issue of connections and partnerships and how all of us coming together can really make a big difference. So I just want to start with that and say thank you to the government of Norway, to the Ministry of Foreign Affairs, to NORAD, to Norfund, and to all who have made such a difference, not only here in this part of the world, but clearly around the world. Now I'm going to just start and be brief. I'm going to talk a little bit about CARE, who we are, and then talk about some of the partnerships that we're involved in that are critical and hopefully give some indication of how an organization like ours, an NGO, really views partnership and how it can make a difference. So let me just start with a little quote here. This is a quote from John F. Kennedy about the CARE package. And as it says here, every CARE package is a personal contribution to the world peace our nation seeks. It expresses America's concern and friendship in a language that all people understand. So CARE was established in 1945 by American organizations who wanted to help Europe after World War II. And, a lot of people now know the word CARE package, but forget that this is the origin of, that CARE is the origin of the CARE package. Many families in Norway received CARE packages after the war. The then Prime Minister signed an agreement on CARE packages in Norway in 1946, and 300,000 CARE packages were distributed in Norway from 1946 to 1950. At that time, packages contained, among other things, food, clothing, books, and toys. Now, development has changed a lot since then. That's not our approach. Our approach is no longer giving things to people. But that spirit of building goodwill and reaching those most in need is still part of our history and the foundation for the organization that CARE is. By the way, I just wanted to also acknowledge my CARE colleague here from CARE Norway, Torrig Skolholm, who has been, and CARE Norway, who has been such wonderful host to us throughout this. So, CARE has a history of partners, not just in the United States, but all over, and our former chair of our board is also sitting here. So CARE now is around the world. We have a staff of 12,000 people. 90% of the staff that we have are from the countries in which we work. We, in the last year, served more than almost 90 million people in 82 countries around the world. So CARE is broad. We have gone beyond our original mission to really be an international organization making a difference for people around the world, and particularly working with people to build their capacity. So who are we today? First of all, CARE's experience has taught us that building capacity in 3 key areas, education, health, and financial services, can ultimately be key to breaking the cycle of poverty that we seek to have an impact on. This includes things like addressing discrimination, rights, denial, poor governance, and power imbalances that are ultimately at the core of making a difference in poverty. We have also focus on the largest group that is facing systematic discrimination and marginalization in the world, girls and women. When women and girls become empowered, they care not only for themselves, but they also invest in their families, and they make a difference for their whole communities. And ultimately, we believe that if we invest in the life of a girl and a girl or a woman, that we will make the biggest difference, not only for that girl or woman, but also for her community, for society, and ultimately the world. And then finally, the reason that we're all here building partnerships. We understand that we can't change the world on our own. We're a large international organization, but we cannot do it without the partnerships that are represented here in this room, whether it's government, whether it's the private sector, other NGOs, but that's where we believe we're gonna have the greatest multiplier effect by working in partnership. But let me say a little bit about, again, why we focus on this issue of girls and women. No matter what area you look at, whether it's the number of people who live on less than $1 a day, 70% are girls and women, children who are out of school, 2/3 of those are girls, women work more hours, 70% of the working hours, but only get paid 10 to 20% of working wages. And if you look at global illiteracy, women and girls make up 75% of those who are illiterate. So no matter what scale you use, girls and women bear the brunt of poverty, but also have the greatest hope for changing the world. So this cycle is our virtuous cycle that looks at not just the fact that girls and women bear the greatest brunt of poverty, but no matter where you look on this cycle, whether it's the years of schools that a girl gets, which boosts her earnings, or children educated who are women who are educated, whose children will be less likely to die, or higher incomes, which increase skills, which then lead to lower population. No matter where you enter on this cycle, investing in girls and women is going to have a great impact for people, not only, as I said, not only for women and children themselves, but also for whole communities. So let me move from a moment from what we do and some of the things that we're involved in to talking about this whole issue of building partnerships and why this is so critical for what we do. We can do more now because we have new partners in the fight, all of you. And we're thrilled to be here and to be here with different partners, because particularly our private sector partners who are increasingly becoming engaged in the virtuous cycle. As I often say, no longer can you say, here's the private sector and here's the public sector or the NGO sector. More and more, those lines are being blurred, and more people realize that they can do well and do good at the same time. And that's why we're so happy to have global businesses now realizing that their greatest growth will be in the new and emerging markets around the world. People we serve are not just beneficiaries, they also are potential producers, consumers, and contributors in our partners' value chain. And so it's not just about doing the right thing, but it's also the reality that several people have mentioned, that this is where the new markets are. That's why we engage with corporations on multiple levels, as philanthropy, expertise sharing, developing of pro-poor business models, and the engagement of employers and consumers to extend CARE's voice and impact, and I'll talk a little bit more about that. We also leverage our public and private partners, creating a mixed pool of resources and enabling efficient public-private partnerships. Any effective partnership with the private sector is an essential part of finding solutions to some of the complex global problems that we've talked about today. when we think about whether it's climate change, population, maternal health, any of these issues, there's no way that we can do this by ourselves. And so these partnerships are critical. This is a schematic of our approach to private sector engagement. And I'll walk through this a little bit, but just to say, we're involved in both micro strategy, thematic strategy, and then multi-sector strategies as we look at the way in which we partner with the private sector. First of all, micro strategy, one-on-one engagement with individual corporations. There are many corporations that we work with who say that they're interested in one particular country, one particular sector, one particular strategy. So that's one way to engage. But increasingly, the private sector is looking at their engagement in a broader way. So thematic strategies, for instance, engaging in the agriculture sector. We're involved in a variety of different partnerships with companies in the agriculture sector, or the cell phone and technology sector, people who are interested in working in that sector more broadly, or also multi-sectoral strategies where we leverage and capitalize on a variety of different ways, whether it's academic, corporate, U.S. government, but pulling all of those different sectors together as we look at the work that we do in the field. So a good partner for CARE is one that we can develop a long-term and strategic relationship with. The one-on-one is good. On the other hand, being involved in, over the long haul is, and looking at how we learn from each other, that is obviously much better in the long run, be mutually beneficial. How will what we do help and serve our population, poorest people in the world, but how do we also make sure that there's a mutual benefit for the organization in which we're working for? Thinking beyond philanthropy and seeing how the business actually connects with what we're doing, and looking at how do we share what we have, but in a way that also contributes to the business interest. Again, I'll show that schematically in this diagram. We believe that there are three important ways to engage with the private sector: partnering, advocating, and investing. So partnering, I'll talk about that and I'll show you some examples. Advocating, we also work closely with many of the corporations to influence how they engage with the poorest of the poor, people at the bottom of the pyramid. And then looking at investing. It's also clear to us that grants, which have been so much a part of the way we work, is not enough. We cannot continue to only look at money that lasts for 1 or 2 years, but how do we actually invest in a way that is sustainable and make sure that we have resources that continue to generate. So let me just show some examples of this. This is how microfinance works for the poor, and we've mentioned microfinance before, and the real treasure that microfinance has been for many people. And this is in Ellis. This is a woman that we work with who lives in a small village in Malawi, where CARE has helped to start a village savings and loan program. 11 women created that village savings and loan program. Each contributed 19 cents. So this was not something that came from people who had incredible resources. They contributed 19 cents a week to a common fund so they could give each other loans, and then do that in a way that helped them to realize their own dreams. With her money, Nellis opened the first grocery store in the village that she lived in. Her friend, Nelia, brought the first TV in town and runs a community cinema. A woman named Patience earned enough money to raise 19 pigs and 10 goats. Last year, Patience generated more than $350 in savings. That means that she has, we think about people who live on less than $1 a day. That means that she has almost a year's income saved away to give her and her family financial security. This group that began with 11 women now has more than 90 women participating. More than just a loan, these women are also achieving financial freedom, saving their money, planning for their future, and most importantly, building a new sense of self-awareness about their own self-worth in a way that money alone does not do. So this is both generating income, making a difference for their family's future, but also, and perhaps most importantly, it's changing the way women think about themselves in societies where their value has not been recognized. And Nellis is just one of millions. CARE is actually the originator and global leader in the Village Savings and Loans program in Africa. And we now reach more people in Africa with financial services than any other NGO in the world, over 3 million people to be exact. We're now in 36 countries, 25 of them in Africa. Almost 80% of them are reaching women, and savings have amassed to more than 23 million and credit dispersed over 35 million. So this Village Savings and Loans program is something that continues to give and continues to build. Let me say a little bit about our partnership, and I'm really pleased to talk about in this conference where we're focused on innovation and how can technology be an enabler. This is a partnership that we have with M-Pesa in Kenya and in Tanzania. M-Pesa is a phone-based money transfer system, as was talked about earlier, and it's a partnership with Safaricom and CARE that's decreasing the cost of providing financial services to poor people. It's been tremendously, tremendously successful, and it was just launched just 4 years ago, and it now reaches more people in Kenya than the entire formal banking system. So if you can imagine what it's like to live in a rural area and have no access to formal financial systems, this has really totally changed the equation in that way. M-Pesa in Tanzania allows Village Savings and Loans to create group e-wallets that are convenient to access safe and use a safe money storage to aggregate these transactions. This transaction that I talked about, 19 cents per woman, I mean, there's huge transaction cost to that. So the ability to have this kind of e-wallet, if you will, where people can amass their savings and not just have the small amount of savings that they have had in the past, but really to be able to have this ability to access formal financial systems. In Bihar, one of the poorest states in India, another area where we're using mobile phone application for health, not just for financial services. So this is a technology that has been helping us to improve the chances of women surviving pregnancy and childbirth in places like India. And in Bihar, as I mentioned, it has one of the lowest rates of antenatal care, one of the poorest states within India. We've used the mobile phone application. CARE and D-Tree International launched this to improve the care of pregnant women in one district in Bihar. It takes health care workers step by step through the process of delivery of care for pregnant women, a solid framework for planning, service delivery, and evaluation of the care provided. Again, if you can think of a woman in rural India who would otherwise have no access to cutting-edge medical care or the needs that she has during pregnancy, this is a way of leapfrogging so that she and the healthcare workers in that village have access to cutting-edge technology. I mentioned advocacy. CARE in Rwanda and the Ministry of Health are training public health workers to use mobile phones, using text messages to monitor pregnant women. And this, again, like in India, has really revolutionized the access to health care, but now is also a way of scaling up, because so often we do these pilot projects that are successful, but then don't have a way of actually scaling this up. So using text messages, they're submitting data from remote villages on the status of pregnant women, and now health workers have taught others using the mobile technology. Over 900,000 women have access to prenatal care that otherwise wouldn't. So, you know, we're working on not only how do you have successful pilots, but then how do you scale those pilots up, and how do you make sure that the governments in the countries in which we're working in use these successful example. And finally, I mentioned investment. This is a program that we're working in Bangladesh, the Rural Sales Program. CARE has helped to facilitate the employment of poor women to sell to their local communities simple things like shoes, toiletry, health supplies, hygiene, and food from companies like Danone and Unilever and others, to both help to extend the reach of corporations, but also to give poor women the income and the ability to provide for themselves and for their children. It's been incredibly successful. During 2009, the program increased private sector sales by more than 200%. So it's doing good things for business as well as making a difference for the lives of poor women. The enterprise is going to create employment for over 12,000 women during in this year, 2011, and already 300 women have averaged $19 a month in income, or a 250-fold increase from the time that they started. And you know, the communities in which they work have access to products that they would not have had before. So, finally, in closing, as you can see, in Kenya, in India, Rwanda, and Bangladesh, these programs are making a real difference. We've been able to build partnerships that have made a key difference, but also to be able to show that businesses can do well at the same time that they do good. It's clear that we're helping others, but also advancing the company's bottom line. And I think there's tremendous possibility and tremendous opportunity with this kind of complementary approach. So we're just thrilled again to be here, and we hope that this meeting will be a chance for people who come from government, private sector, and the civil society sectors to come together and to think about how can we be better together than we would be working in our own different silos. And these are just a few examples from our experience that hopefully will be stimulating and a chance for more dialogue throughout the day. So thank you.